Marek disease virus, MDV, also known as folly paralysis, is a very common disease of chicken caused by herpes virus. Marek disease affects both commercial and backyard poultry, and it may result to a severe production loss. Most of the deaths from Marek disease occur between 8th to 20th week of their age, and also between their early ages of maturity, of growth, between the 3rd to 4th week. These are already matured birds. So if they are affected by Marek and they die, it's a great loss. So it's very important for a farmer to take note on Marek disease and to ensure that you purchase the birds which are well vaccinated against Marek disease. Before I continue, if you are new here, consider subscribing. Also, we thank the new subscribers who have chosen this channel. Thank you very much. So as we continue, I want to share on the signs, or rather clinical signs, that a farmer can identify. One of the signs that is very clear and visible when Marek attack your birds, so there is a limb paralysis. The limbs, the birds, either both of the limbs become paralyzed, either the two legs become paralyzed or one of the leg become paralyzed, sometimes the neck, and also sometimes the wings. Also, the birds are unable to stand. So when the limbs are paralyzed, these birds are unable to stand. And it's very important when you are giving your chicks or your birds feeds, don't be in a hurry. Make sure that you're giving your chicks feeds while remain in the poultry house for some time. Try to identify if your birds are all okay, if your birds are able to stand, all of them. If they are active, it will help you a lot. So some of the signs as I continue. Marek disease can also affect the eyes of your birds. This may result to blindness, but this is not mostly the case. It is a rare case. Marek disease occurs as a tumor in internal organs. So when there is a post-mortem of these are the organs that the tumor may be found in them, like the ovaries, the liver, the spleen, the kidney, and also the heart. Also, the birds show signs of depression. So you can see your birds are depressed. Also, they lost appetite, and also they lost weight. That's why I'm encouraging every farmer. So when you're feeding or you're giving your feeds to your birds, don't be in a hurry to get out. Also, these birds may show a sign of dehydration, and this can be identified by shrunken combs. Sometimes there is diarrhea, so you can find some evidence of diarrhea. And sometimes there is no sign, so maybe there might be a sudden death. So sometimes the birds may die without showing any clinical sign, and that is a very dangerous occurrence. Okay, let's see about diagnosis. How can this disease be diagnosed? So this can be done by a veterinary examination. So maybe let's say there is a sudden death, or your birds are dying without any signs. You wake up today and you find two birds are already dead. So you take those birds to a veterinary, a qualified veterinary, and you may try to cross-examine and to see what might be the cause of the death. And again, Marek disease, there is a similar disease known as lymphoid leukosis. It is almost similar to MAREK. It causes tumor in internal organs but does not cause paralysis. So maybe you may take these birds to a veterinary and you see that the internal organs have tumor. This will not be necessarily a MAREK disease. So the difference between these two diseases is lymphoid leukosis does not cause paralysis, but MAREK disease causes paralysis. And also lymphoid leukosis affect older birds at their 16th week of age, but MAREK affects younger birds. So make sure that you know there are these two differences. Also, let me share some method on how this disease is spread. Also, the virus is shed from feathers, follicles, spread rapidly in flap, in dust. So when the birds flap their wings, the virus is shed, and this virus may continue to affect other birds. Also, people who are working inside the poultry house may transport, or they may carry this virus to other birds, and also the equipments which are used in the poultry houses. Also, when these birds breathe infected dust, unfortunately there is no treatment for MAREK. So when your birds are affected by MAREK disease virus, so they either die or grow with it. Prevention, yeah, there is a way a farmer can prevent this, and one way is through proper vaccination. So most of the hatchery, they vaccinate the birds or the chicks against MAREK in the hatchery. But if you have your own hatchery, make sure that you vaccinate your chicks against MAREK disease. Another way of preventing MAREK is by practicing good biosecurity measure. Another one is chicks should be reared separately from older birds. This is to make sure that the older birds will not spread the virus to the younger birds. And again, disinfect the shed and also the equipment. You can do this before bringing in new. You can do this before bringing new chicks to your farm, and also after maybe taking your birds to the market, make sure that you disinfect. Again, you can give your chicks or your birds good nutrition. This is to make sure that your birds develop good nutrition enable your birds to develop good immune system that will prevent, or it will make your bird secure against disease causing organism. So when you practice all of this, it will help you to not only to prevent the birds from being attacked by MAREK, but any other diseases.